Hey guys, the medicaphilic guy here, continuing the cardiac system we will dive into. Second part of heart anatomy, focusing more on its internal features. First of all, let's take a look at the sulci of heart, because that will help us to know exactly where the inner chambers are. The first one is the coronary sulcus, also known as the atrioventricular groove. This sulcus is a prominent groove that separates the atria from the ventricles, visible on both the anterior and posterior sides very clearly. Another sulcus you will see is anterior interventricular sulcus. This sulcus continue posteriorly as posterior interventricular sulcus, and we can guess by the name that these separates the left and right ventricles. One important thing to remember is that important blood vessels that supplies the heart itself lies in these sulci. Moving on to the internal features, the human heart consists of four chambers: the right atrium, left atrium, right ventricle, and left ventricle. The right atrium includes the right auricle, an extension that enhances blood perfusion. Remember, the auricle is just a part of atrium, not a different structure, because I used to be confused with these. Upon removing the lateral wall of the right atrium, its internal structure becomes visible, revealing six distinct walls. Anterior and lateral walls has pectinate muscles comprising striated muscle fibers that facilitate contraction of the right atrium into the right ventricle. The superior wall has an opening for superior vena cava, and on the posterior wall we can find opening for inferior vena cava. I know it's a bit confusing that this opening should be associated with inferior wall, but as the heart is tilted a bit forward, so inferior vena cava becomes part of posterior wall. On this posterior wall, we have another embryonic valve called valve of the inferior vena cava. During embryonic life, the blood went directly from inferior vena cava to left ventricle through oval fossa. This one, on the posteromedial wall, because in fetal life there is no pulmonary circulation as fetus gets oxygen from placenta. The medial wall is actually the interatrial septum. There is a small opening called coronary sinus, present between medial and posterior wall, and through this vein heart drains the blood from itself. Lastly, the inferior wall is there through which blood moves into ventricle through atrioventricular orifice containing tricuspid valve. Moving on to right ventricle, it has a triangular shape. At the base of right ventricle, you will find the right atrioventricular opening through which blood will move from right atrium to right ventricle. There is valve present at this opening, called the tricuspid valve, called so because it has three cusps, the anterior, posterior, and the septal cusp. Also, there is RI in the tricuspid, which I use to remember that tricuspid valve is in right side. This valve will make sure that blood is moving in one direction from right atrium to right ventricle and prevent regurgitation during ventricular systole. The second opening is the opening of pulmonary trunk, through which blood will leave right ventricle and move to lungs to get oxygenated. The valve present here is called pulmonary valve, and it is made up of three semilunar cusps. Within the ventricle, you will see a rough inner layer called trabeculae carnea. As blood enter the ventricles with high velocity, and there is a high chance to make air bubbles, as there is a sudden break for the blood here, and these bubbles can cause air embolism. This trabeculae makes sure this doesn't happen and gives a potential smooth landing to the blood. It also increases the surface area. Now, these tiny muscles are called papillary muscles, and they are attached to the tricuspid valve with the help of these structures called chordae tendineae. These structures work collectively to make sure that the valves are not pushed back into the atria as the ventricles contracts by holding the cusps of the valves just like a spring. The separation between atria and ventricles are called interatrial septum and interventricular septum, respectively. The upper part of interventricular septum is membranous, while the lower part is muscular. We already know about tricuspid and pulmonary valve. The remaining two valves in the heart are the mitral valve, through which blood will move from the left atrium to left ventricle, and the aortic valve, through which blood will be distributed to the whole body from left ventricle. Mitral valve is also called bicuspid valve, and it is the only valve that has only two cusps. The left ventricle is larger, thicker, more muscular, and generates more pressure than right ventricle because it has to overcome more resistance and pump the blood to the whole body. In the end, just clarifying the blood flow direction, the blood flow pathway begins with deoxygenated blood from the body entering the right atrium through the superior and inferior vena cava. From the right atrium, blood passes through the tricuspid valve into the right ventricle. And during systole, it's pumped to the lungs through the pulmonary valve for oxygenation. Following oxygenation, the oxygen-rich blood returns to the left atrium via pulmonary veins and then flows through the mitral valve into the left ventricle. Lastly, the oxygenated blood is ejected from the left ventricle through the aortic valve into the aorta, distributing oxygen to the entire body. Thanks for watching. Hit like and subscribe my channel. Thank you for the support.